Have you ever received, or do you know someone who has received, a mental health diagnosis and didn't know exactly what to do next? Many people believe that a diagnosis is a definitive sentence, but the reality is quite different. Properly understanding diagnoses is essential to expanding treatment options and improving quality of life. In this video, we will explore the differences between medical and mental health diagnoses, clarify misconceptions, and present ways to take a more complete and effective approach. If you want to better understand how mental health diagnoses can help rather than limit, stay with us. And don't forget to subscribe to the channel for more content like this. Understanding mental health diagnoses. Many people have a mistaken understanding of mental health diagnoses. It's often believed that a diagnosis is a fixed label, something that defines a person's identity forever. However, a mental health diagnosis should be seen as a tool to understand patterns of thought, emotions, and behaviors, enabling more targeted and effective treatment. Unlike traditional medical diagnoses, which usually identify a specific cause, such as a viral infection in the case of the flu, mental health diagnoses describe a set of symptoms without necessarily pointing to a single origin. Anxiety, depression, and mood disorders, for example, can have multiple causes, including genetic, environmental, and behavioral factors. By better understanding the role of a diagnosis, it's possible to expand treatment options, seeking more personalized approaches that consider each person's individuality. This means that no one should feel limited by what's described in their diagnosis, but rather use it as a guide for self-awareness and the search for effective solutions. Differences between medical and mental health diagnoses. To better understand mental health diagnoses, it's important to compare them with traditional medical diagnoses. Imagine a physical condition like the flu. Symptoms include fever, sore throat, and fatigue, and its cause is usually a specific virus. A medical diagnosis directly points to the root of the problem, allowing for clear and targeted treatment, such as antiviral medications or rest. On the other hand, mental health diagnoses work differently. They don't identify an exact cause, but rather describe a set of symptoms the person is experiencing. For example, someone diagnosed with depression may experience persistent sadness, low energy, frequent crying spells, and hopelessness. However, the root of these symptoms can vary widely, from genetic and biological factors to life experiences and thought patterns. This difference can create frustrations and misunderstandings, as many people expect a quick and specific solution, similar to physical illnesses. However, understanding that a mental health diagnosis is a starting point rather than a final destination is essential to seeking comprehensive and effective treatment. Misinterpreting a depression diagnosis. Receiving a depression diagnosis can be frightening and often misunderstood. Some people see it as a definitive sentence, believing they will never improve, while others may view it as a personal failure, feeling shame or guilt. However, it's crucial to understand that a diagnosis does not define who you are. It simply describes a set of symptoms that can be treated and managed. One of the most common misconceptions is the idea that depression is merely a chemical imbalance in the brain. While neurochemical factors play an important role, the origin of depression is multifactorial, involving genetic, biological, behavioral, and even experiential aspects, such as trauma and prolonged stress. This simplified view of chemical imbalance can limit treatment possibilities and lead people to believe that medication is the only solution. Recognizing that depression can be caused by a combination of factors opens the way for a broader approach, including lifestyle changes, social support, and complementary therapies. Understanding this helps reduce stigma and encourages the pursuit of solutions beyond medication, promoting a more complete and sustainable recovery. The negative impact of labeling and stigma. Unfortunately, being diagnosed with a mental disorder often comes with labels and social stigma that can make the journey even more challenging. Statements like, "you are depressed" or "you are anxious" reinforce the belief that the condition defines the individual's identity, as if it were something permanent and unchangeable. This type of thinking can lead to feelings of shame, isolation, and even resistance to seeking help. However, It's important to understand that having a diagnosis doesn't mean being doomed to live with that condition forever. Mental health is dynamic and can be improved with proper treatment, lifestyle changes, and adequate support. Another important aspect is accepting the condition without allowing it to become a limitation. The diagnosis is real but not unchangeable. Many people can fully recover or find effective ways to manage their symptoms. To overcome stigma, it's essential to seek knowledge, openly discuss mental health, and understand that asking for help is a sign of strength, not weakness. The support of friends, family, and professionals can make all the difference in the recovery process. Contributing factors to mental health. Mental health is influenced by a variety of factors that go beyond biology. Often, people focus only on genetic or neurochemical factors, but forget that elements such as diet, sleep quality, and life experiences also play a crucial role in the development and maintenance of mental disorders. For example, nutritional deficiencies, such as a lack of B vitamins, omega-3 fatty acids, and magnesium, can directly affect mood and energy levels. Similarly, sleep deprivation can lead to hormonal imbalances that intensify symptoms of anxiety and depression. Stressful events or past traumas can also create negative emotional patterns that impact how we face daily challenges. Another important factor is distinguishing between genetic predisposition and functional impact. Having a predisposition to a certain disorder doesn't necessarily mean it will manifest. Lifestyle, environment, and coping strategies can either mitigate or enhance this predisposition, showing the importance of a holistic approach to mental health care. Therefore, when addressing mental health issues, it is essential to consider multiple dimensions of life by adopting healthy habits, building support networks, and seeking a balance between body and mind. The duality between biology and behavior. For a long time, there was an extreme divide in approaches to mental health. On one side, the purely biological view, which attributes mental disorders to chemical imbalances in the brain. On the other, the behavioral or moral perspective, which believes that changes in attitude and thinking alone are enough to solve the problem. However, the truth is that these two aspects are deeply interconnected and should not be treated in isolation. Recent research shows that our thoughts and emotions can alter brain chemistry through neuroplasticity, the brain's ability to adapt and change over time. This means that practices such as cognitive behavioral therapy, mindfulness, and healthy habits can, in fact, positively influence the brain's biology, promoting real and lasting changes. On the other hand, ignoring biological factors and not seeking proper support, such as medication or specialized treatments, can hinder effective recovery. The most effective approach to mental health is one that acknowledges this duality, combining strategies that address both biological and behavioral or emotional aspects. Therefore, it is crucial to abandon extreme views and adopt a balanced mindset, understanding that recovery involves both internal changes and the right support from healthcare professionals. Treatment options, recovery, and alternatives to medication. One of the biggest questions when receiving a mental health diagnosis is this forever? The good news is that with proper treatment, many people can significantly reduce symptoms or even achieve full recovery. The most important thing is to understand that there are various treatment options, and each person may respond differently to the available approaches. Medication can be a useful tool, especially during critical moments, helping to stabilize severe symptoms. However, it is crucial not to view it as the only solution. Many people avoid medication due to side effects, fear of dependency, or concerns about long-term costs, and these concerns are valid. That's why it is essential to consider a balanced approach that combines different strategies. There are several alternatives that can complement or, in some cases, replace medication, such as cognitive behavioral therapy, lifestyle changes, physical exercise, relaxation techniques like meditation and mindfulness, and dietary adjustments to ensure proper nutrition. These practices help promote well-being sustainably and without the adverse effects of medication. The most important thing is to understand that the path to recovery is personal and multifactorial. There is no one-size-fits-all solution, and experimenting with different approaches with professional guidance is essential to finding what truly works for each individual. Understanding mental health diagnoses in a broad and unbiased way is essential for a journey of self-care and well-being. They do not define who we are, but help guide treatment and recovery. Throughout this video, we have discussed the differences between medical and mental health diagnoses, debunked common misconceptions, and highlighted the importance of a balanced approach that considers both biological and behavioral factors. With proper support and lifestyle changes, it is possible to achieve a better quality of life. If you found this content helpful, like, comment, and share to help more people demystify mental health diagnoses. And don't forget to subscribe to the channel for more content like this.